Good afternoon and welcome to HealthSystemCIO.com's All-Star Panel Attack Vector Update, a webinar tweet chat combo from HealthSystemCIO.com. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com and I'll be your moderator today. We are having a simultaneous tweet chat hosted by our Managing Editor, Kate Gamble. If you want to participate in the tweet chat, you can just go into a separate browser or use your phone and use the hashtag HSCIOchat. If you want to just view it, you can view the tweet chat in the Media Viewer panel on your right-hand side. Other WebEx panels that will come into play today are the polling panel that we'll use when we launch a couple of audience polls today, and the Q&A panel. So you can use that to submit questions at any time for the panelists. Just type into the Q&A panel, the lower right-hand corner of your screen, and keep the default set to all panelists. Send those in as they occur to you, and we'll take them later in the program. And you can download the deck using the URL on your screen, or you have a shortened URL at the bottom of all slides. Just so you see how we're going to spend our time today, we're going to go about 45 minutes. First, we're going to have our panel discussion with Bryan Kissinger, VP of Information Risk Management and CISO with Sharp Healthcare, and David Chou, VP and CIO with Children's Mercy Hospital. So without further delay, we're going to jump right into our discussion. Bryan, can you give me an overview of your organization, please?
Sure. Sharp Healthcare is a not-for-profit integrated healthcare organization located in San Diego, California. All of our operations are in San Diego County. We have 7 hospitals in total, about 140,000 health insurance members, and just over 18,000 employees. Our IT department is around 600 employees, and I've been with Sharp Healthcare for about 6 months.
Okay, very good. David, a little bit about Children's Mercy.
Thank you, Anthony. So Children's Mercy Hospital is located in Kansas City. We are a freestanding children's hospital between St. Louis and Denver, and we provide comprehensive care for children from birth up until the age of 21. We've been consistently ranked in the top leading children's hospital according to U.S. News in all 10 specialties, one of the first hospitals in the Missouri area and Kansas area to earn the Magnet status, and we recently got that as well. We have 2 main hospitals, a little bit over 40 different pediatric specialties and clinics, and we have about 750 to 800 pediatrics on staff. We're affiliated with the University of Missouri, Kansas City, the School of Medicine, also with University of Kansas Medical Center as their principal teaching hospital for the pediatric space. I have an IT staff of in the range between 180 to 200, and I've been here for almost 3 months to date.
Right, so we have folks that are pretty new in their positions, 6 months for Bryan and 3 months for David. David, let's talk a little bit more about, you mentioned 180 to 200 in IT staff. Let's talk a little bit about security-focused resources, if you can give a percentage of staff, if there is a percentage that's solely focused on security, staff spending priorities, and recent initiatives. So just trying to get a feeling for sort of the heft of your security-focused IT resources.
Yep. So our security team primarily resides in the IT organization, but we have a CISO that resides under compliance. So I have seen this model before, a little bit different, where we had the auditing and compliance function acting more as an auditor, while IT are sort of the implementers of the policies and procedures, so that we had that check and balances. In terms of staffing, security has never been on the forte of anyone's radar until the last 2 years, and especially now, the board is very heavily involved on our security strategy. So for me, security is the top priority for me this year, and it is part of my strategic goal for 2016 and 17. We are understaffed. Budget-wise, we do have a lot of money allocated for security. The balance is going to come down to the strategy as far as whether do we really try to build the personnel in-house, or do I utilize managed service? And we can get more into that discussion later on as far as philosophically which model fits, and it really depends on the organizational culture and strategy. And I'll touch base upon that later as far as the strategy we have at Children's Mercy Hospital.
David, just as a follow-up, I've known you for a long time. I would describe you as definitely a security-minded CIO. Do you think that's accurate? And I assume that not every CIO, some are just not sort of into security. I mean, everyone has to be, but you see what I'm saying? I think it's a love of yours or a passion.
Well, the reality is I have been more security conscious in the last year or so, just because of what's been out in the market from the healthcare perspective, all over the news. Every vertical has some sort of security issue, whether it's breaches. So I'm more conscious of that. But internally, I'm battling the desire of creating the best experience for our end users, whether that is the doctors, the clinicians, the patients, or the employees. So it's always a balancing act as far as creating the best experience, but at the same time ensuring that you have the right security measures in place. So I would say the last year I have been very heavily focused on security, just because I do not want to be in the papers for any security incidents. So really trying to be proactive minded, learning about how other industries and other solutions out there to really try to keep our organization safe. You can't do everything, so you really have to figure out how to be proactive. And more, I think the one thing that we have to focus on is how do you practice security? Because no one practices security, so you really have to get in the mode of practicing when something does happen, and how does your organization react? So really educating the organization on security and making that a routine as part of an emergency preparedness, the same way we talk about hand washing in the hospital, we really have to put security at that scale because the exposure is tremendous.
Very good. Brian, you want to take a shot at the question?
Sure. We have a combination of information security resources on my team, but we have a small team, including myself. It's 11 folks, and then another handful of individuals who work in our technical assistance center who help address security access, provisioning, deprovisioning, password resets, and things like that. So out of our nearly 600 IT employees, we have less than 20 that are fully focused on security.
So, David mentioned that he feels they're understaffed in terms of security. Would you feel the same way?
Well, I've been fortunate to, when I came into this position, that our CIO was willing to invest in some additional resources. So I've actually added 2 FTEs in the last couple of weeks, and probably plan to add 1 more in the next few months. Honestly, I feel like I'll be staffed at the right level, but who doesn't want to have an extra person or 2 on their team? But we're approaching it from a people, process, and technology perspective, and so rather than have an army of people doing very mundane tasks, we're trying to supplement our approach with automated solutions and potentially even somewhat of a hybrid model managed security service that we're looking into right now.
Yeah, and I think David mentioned that debate, and we can touch on that shortly. David, and this may be tough to answer having been on the job 3 months, but maybe you could answer it in sort of a general way if you want to talk about past positions or whatever. Have you had any significant incidents in the past year or 2? If so, please talk about them and what you learned from them.
Yeah, I better knock on wood for answering this question, but at this point, nothing publicly for Children's Mercy Hospital, but we do see potential phishing attacks that are trying to get through our perimeter, so we are catching those externally. My last organization, there's something that happened before my watch there where we had a laptop that was stolen. The laptop did not have any PHI, but it was unencrypted. So my question has always been, and maybe Bryan can chime in, is if you have a device that's stolen but there's no PHI access, you have to report it. So in a very risk-averse organization where I was, they decided to report it. Unfortunately, they got hit with about a $2.5 million fine. And I also understand the way the OCR looked at it was there was an assessment done just a few years ago, and the follow-up has been still the same. Nothing has improved much. So maybe that was the measure to really make sure the organization takes some proactive measures for security. But the question I always had in the back of my mind was, if it does not have any PHI, where there's not any patient-sensitive information, does it have to be reported? And so I've always, that was on the back of my mind when I went to take on the role, when I found out about that possible exposure about 6 months before I joined.
Brian, you have any thoughts on David's question or David's musing?
Yeah, I agree. I've worked for some very conservative organizations that will tend to err on the side of reporting versus not reporting, and sometimes that's a bitter pill to swallow, but it might be the safest way to go. We haven't, again, knocking on wood as well, no one wants to jinx ourselves, but we haven't had anything public and notable recently, although we do see on a daily basis incidents, locky, ransomware that's been out there. Fortunately, our technology solutions and monitoring activities have caught these before there's been any sort of breach or anything that caused us to have a denial of service.
Right. Definitely want to keep an eye on that stuff. Let's talk a little bit about preparedness. David, some say healthcare is one of the least prepared industries, and do you agree, and why do you think that might be the case?
I would tend to agree. I won't say healthcare is, I would say almost every industry is not as prepared. If you think about just in general where the healthcare industry has gone the last 8 years, the focus has been to move towards electronic, right? So everyone's made a big push. Everyone's focus has been on implementing EMR solutions. Security has been on the radar, but really not at the high of the radar until things have happened the last few years, where now it's on top of the radar. So because everyone's focus has been on EMR, security has always been on the back burner. It has not been at the forefront. Therefore, most organizations are not as prepared, whereas now we're trying to catch up versus the financial sector that has always been preaching security, trying to make sure security is on the top of the mind. Healthcare is really playing catch-up at this point. So we could really learn a lot from other verticals, understand how they tackle security, and think about how it could be applied to healthcare. So we are not prepared, and we are trying to play catch-up at this point, in my opinion.
Brian?
Oh, I think a lot of good things have been put in place at Sharp over the years, and while I think that you can always improve, I wasn't overly worried about the information security posture of the organization coming in. There's a lot of next generation technology available out there. If anyone went to RSA, you'll know that vendor showcase is starting to look a lot like HIMSS, where it used to be just a few niche players. And so for me, it's kind of weeding through all of the options and what is it that's going to give us the most cost-effective, pragmatic solution to supplement what we already have in place. We're doing some defense in depth and layering and using some of these user behavior analytics and malicious software sandboxing technologies to help us against these advanced threats that we're seeing on a daily basis.
David, I want to ask sort of a follow-up question there. And Brian, I'll touch on this with you too. Now, you're both pretty new at your organizations. And David, you had even mentioned that there was an incident at your previous employer, which was sort of right before you came on board. My question is, when you're looking at a new opportunity and investigating a new place, either as a CISO or a CIO, how much do you want to know about the security posture? You don't want to go in and then 3 months in, before you've had a chance to affect anything, there's a breach and your name's on it. So what are your thoughts about that, David?
Yeah, you would never know. That's the reality. A lot of it has to fall on the individual to really investigate, ask around, ask their peers, talk to folks, but you will never know. You may hear things during the interview process before you walk in and commit, but potentially you may never know, and you may just fall into a situation where you have no control. So for me, I try to be proactive and really try to understand what can we do. A lot of it has to do with understand the department structure. So my recommendation would be for new leaders, potential leaders that are thinking about joining a new organization, really understand the org structure, understand how much shadow IT there may be, because that can give you a clue as far as potential security issues, and then really go in with a strategic mindset before you start of how do you want to tackle some major areas like security. Do you need to build a whole entire team, or are you able to build an entire team? One of the challenges has always been, let's just say we get the approval and the funding to build a big security operations. But finding these talents is very tough. One of the biggest challenges that we're facing in IT is finding the right security talents. So even if you get the budget, you may not be able to find the right resources. So what is your plan of attack there? So I think the combination of understanding the organizational structure, the department structure, asking lots of questions, that is all you could do before taking on a new role. And we're always have that risk of potentially having an incident that may not be disclosed. Or it could be an incident did happen, but you don't discover it until you arrive and you're involved 4 or 5 months later. Then you're still there. So it's really about how do you react to it, and do you have a plan of attack when something does happen.
Brian, is this something that security professionals should think about? Because, if you look at sort of the date of an incident and someone's LinkedIn profile and you just match up the dates and go, oh, they were there, it kind of is on them. So even if it wasn't your fault or you had just started or, it's on you. So are there things you want to find out about a place to make sure it's up to a certain level before you jump in?
Absolutely, and I think David said it very well. In fact, that when I was interviewing for this position, I was pretty happily employed before, so I felt like I was in a position to ask our CIO very difficult questions. I asked to see the organizational chart. I asked to understand what the budget was and the commitment to future budget, what the level of governance and board level interest and oversight was going to be in the program. And I certainly did my own research in terms of any sort of history of breaches or public disclosures that the organization had. So I think you, like any job, you have to do your due diligence on the way in. And I don't worry about so much anymore having a breach on my watch. Again, knocking on wood, everyone is being hit with these attacks, and the news cycle now is so shortened on them that, almost everyone's forgotten about Banner already this week because, everything else is happening in the world. So I don't want it to happen, but I don't lay awake at night worrying that something may happen because it's probably not a matter of if, but when.
Right. Very good. Okay, this is sort of, it feeds off our last discussion for a little bit. David, your thoughts on using consultants for any kind of gap analysis to figure out where the organization is versus where it should be, or at least things that you do in-house?
Yep, so I think for any organization or any new leader that needs to react quickly and be able to get an assessment quickly, you would have to get some outside perspective. So we do have auditing that are performed by outside consultants and firms to provide the risk assessment and provide a gap analysis. The challenge is going to be, we all know what the gaps are. We could walk into any organization and highlight this template and say, here are the various gaps, because it's very common. You may not be able to fix all the gaps, or you may not have the time. So there are always going to be the same gaps. The challenge is going to be how do you implement it? Do you have teams implement it? Do you have the resources? So that's where, from my perspective, a managed service can come in, help us monitor, and potentially help us get some quick wins, along with the in-house team that you have, which I would say majority of the healthcare organizations in the U.S. are probably understaffed or may not have the manpower or even the skill sets to perform the gap work when a security assessment has been done. So we do utilize consultants and firms heavily to, number one, do the assessment for us, and number two, potentially provide some sort of managed service along with implementation work.
Bryan, what are your thoughts on that?
I agree. I was fortunate prior to coming into this role to inherit a public accounting cybersecurity assessment that was done on our program. So on day one, I was handed a 60-page report, and I went through that. I thought it was a good report. It had some areas that they didn't look at, and so in my first 30 days, I did a supplemental gap analysis and added to it. And frankly, my next 12 to 18 months plan is largely based off of that report and what I did to supplement it from a technology perspective. So completely support the concept, and in fact, I've asked our internal audit team to hire the same firm next summer to come back and look at us again because I want to know how we're progressing and if we're maturing as a program and reducing risk.
Great. David, let's talk a little bit about reporting structure. You said your CISO is under compliance, I believe, so there's not a direct relationship there from an org chart point of view, but talk more about that and if you think that's optimal or versus what you think is optimal. And then, Bryan, I'll have you touch on that as well.
For me, as long as we are able to work together and collaboratively, I'm okay with the reporting structure. It gives me more of a check and balance where we have the CISO provide a more auditing function, policies and procedures, and folks on my team under IT are the actual implementers. But at the same time, every change that we make, we must have some sort of check and balance with the CISO and the audit and compliance. So it works. I don't know what the right structure should be. I've also had it where the CISO reported to me directly as the CIO, and that worked as well. The challenge, well, I won't say the challenge, the work there is a lot of communication with the organization that falls back on me, with the entire organization all the way from the executive leadership down to the end user. So whereas now when we have that separation and duty with the CISOs under compliance, I really rely on them for the formal communication out to the organization while we are more of the boots on the ground, making sure the technology is sound and we have the right infrastructure in place. So that's worked well so far, but I don't know what the right model should be. I think it really also depends on the organizational culture.
Bryan, as a CISO, what are your thoughts on the whole reporting issue?
I pretty much concur with what David said. I mean, I report to the CIO here at Sharp, and as long as the support is there within IT and outside of IT and at the various governance committee and board level, I think it works perfectly fine. There are times when I step back and say, boy, would I have a little bit more impartiality if I didn't report up through IT, but the other side of that coin is that I feel a very strong partnership with everyone in IT, and I feel like we're getting a lot of things done quickly because of my proximity to being in the IT department. So I think there are some pros and cons probably to any place that the CISO would sit in the organization.
Very
and
good.
Anthony, I've also...
Go ahead, David.
Sorry.
Go ahead.
I've also seen lots of white papers where the question has been asked whether the CISO should report to the CEO directly. So that may also change the model, because then who develops a team to secure and do and implement the solution? So that's always been a question I had on my mind when I read those articles or those things related to where the CISO believe they should be a board level discussion, which I truly believe security is a board level discussion now, but the reporting is outside of IT, outside compliance, and directly to the CEO.
All right, very good. We're going to touch on the idea of ransomware, the concept of what's going on there. So we're going to get a quick poll out to the audience. We have policies in place for everything. Does your organization have a ransomware policy in place which stipulates when and if it should pay? So if you work for a health system and you can answer that, great. If you are knowledgeable of a health system, they're among your clients, just answer to what you think is going on out there. Obviously not scientific. We just want to get a sense of if people are putting policies in place around scenarios and when and if we pay, and numbers and things like that. So now we're going to discuss that with our panel. Brian, do you have a ransomware policy in place, and do you recommend an organization come up with policies before something happens? And obviously you need to do your best to make sure those remain private so that folks, you're not wearing a big sign that says we pay.
Yeah, we don't have a policy per se, but I can tell you the question has been asked and discussed at every governance team meeting and board committee meeting that I've been at and presenting on. There's a lot of mixed messages out there. I think publicly the FBI would tell you not to pay the ransom, but they also do not advise you to negatively impact your financials by being down for 30 days or something like that. So I think it's a business decision ultimately. I think that we would have to answer two key questions. Do we know what caused the ransomware attack, and can we prevent it in the future? And how quickly can we return to normal operations? And the answer to those two questions would probably lead us to a decision around paying a ransom. For example, if we don't know what is causing us to be down, simply paying the ransom probably wouldn't do us a lot of good, because we could have the same exact ransomware sent to us an hour later. And then secondly, if it's going to only take us maybe a few hours to eradicate the ransomware and get back to normal operations, that's an important data point versus we're hopelessly deadlocked and it could be weeks. I think that's a very different answer.
David?
Yeah, I just checked on whether we do have a policy, but we don't. There have been discussions as far as should we even create a Bitcoin account and put some funds in there just in case, but at this point we don't have any formal policy. I think it's important for the organization to really think about the risk and think about, do they even have a cybersecurity insurance policy? I think that's one thing that has been popping up and has been heavily on the rise for lots of healthcare organizations. So one of my recommendations is going to be, let's explore a cybersecurity insurance policy if we have one. If we don't have one, if we don't, let's explore figuring out whether it makes sense for us to have one, and maybe that's a mechanism to have in place in case you really have to pull out a checkbook to get your operations back on. But like Brian said, if you're down for a few hours versus a few weeks, those are two different discussions, whereas if you're down for a few weeks, you're potentially losing millions. So maybe paying the ransom is not a big hit after all, and just to be able to get operations back on track while you stabilize the environment.
Yeah, I think the one ransom paid was like $17,000, which is essentially nothing, right?
Right.
All right, so we see the poll results, 57% do not have a policy, 43% do. I find that 43 number pretty high. Brian, that sounds high to me.
Yeah, that does surprise me. But again, I think that some organizations are probably taking those discussions and formalizing them in a policy right away. it's difficult because I don't know where that policy lives. It's not really an IT policy. It's more of a business decision and a business policy. So I'd probably ask our finance or executive team to own that policy. I would give them the facts and let them make the decision.
Yeah, very interesting. Okay. Many have discussed the importance of having a proactive versus reactive defense strategy. What does that mean to you? Bryan?
Well, I think just in a very simplistic way, think about if you have an intrusion detection system versus an intrusion prevention system. Mm-hmm. And it's one thing to be able to monitor malicious software and other attacks that come into your organization and then action them once they've landed versus taking some sort of proactive steps in terms of blocking or quarantining or sandboxing that threat. We're using a balanced approach. We're getting more into the proactive strategy, but especially in healthcare and probably financial services sectors, you have to be careful what you're going to proactively do. We wouldn't want to proactively shut down access to our electronic health record or to clinical devices that are delivering patient care because we think we might have a security threat. So I think in our industry we have to err a bit more towards reactive or other approaches that look at traffic concurrently while we continue to provide access to information and services along the way.
David, what are your thoughts on Bryan's response?
I would have to agree with what Bryan said, and then maybe to add another sort of thought or philosophy to it is, if you think about your workforce in the hospital environment, I work maybe 8 to 10 hours, maybe 12 hours a day. So most of us do not have a 24/7 operation that's managing security. So are you going to be proactive and feel comfortable with what you have in terms of staffing on site and the tools, the automated tools to monitor? Or do you really want a service that's going to be there monitoring your organization 24/7? So for me, really trying to take that proactive approach and figuring out how can we get 24/7 monitoring of our organization, even on the perimeter. Right? For me, that's more of a proactive approach versus reacting and waiting for something to happen, and then you figuring out, okay, we have an incident, how do we respond? So I'm really trying to figure out can we put together a 24/7 operation that's aligned with the hospital being available 24/7. Same thing for on the security side.
Bryan, let me do a follow-up with you on sort of what David's talking about. It makes me think of how do you have a life as a CISO? I mean, CIOs, we know, you get to that level and you're in technology, it can be all-consuming, 24 hours a day, vacation, everything. And as CISO, it might be even worse. Are there ways that you can, use managed services or delegate, or what can you do to make sure that you have some kind of a life and that you're not always sort of on?
I would say get yourself a good right-hand person to serve as your partner in this journey. I'm fortunate to have started at Sharp and have a director of security operations join with me. So he and I share a lot of these responsibilities, fortunately. We also have an organization here where we have on-call IT folks. And so if something happens when I'm on vacation or off work hours, an on-call person will take that, and if it escalates to a certain level, I'll get an email or a phone call. But specific to your managed services question, we are exploring that. Just as David mentioned, we are not a 24/7 shop, and if something happens at 3 a.m. today, we're likely to address it first thing in the morning. So I'm actually exploring getting involved with a managed security service provider to help us with Tier 1 support, where the thousands of alerts and incidents that need to be investigated would be handled by them, and then we would get sort of a top 10 list of things to address each day. And frankly, I think that's a better model for full-time employees because the work is more interesting, it's more strategic, and you know, frankly, if you're paying a full-time employee salary and benefits to stare at a pane of glass all day, I don't think that's very rewarding for them. And there are a lot of companies out there that's all they do, and they specialize in it. And I'm likely to put an RFP out towards the end of the year for something like that.
David, you want to talk? Let's get into that managed services discussion. Tell me where you are on that issue.
Well, I agree. So I want to be surprised when Brian and myself are getting lots of LinkedIn requests for managers, invites from managed service vendors after this. But it really, I am biased because that is the way, in my opinion, that's the way to go. I cannot build the security operation team like these vendors who are the forte. Same model when you think about data centers versus cloud. Why do people build data centers still when you have cloud infrastructure ready to go? You just can't build it to have that skill set and the capacity. So for me, it's really about utilizing, having someone with that expertise and focus. But secondly, I'm also trying to shift my risk. I want to shift some of the risk to a managed service so that they take accountability and responsibility. So for me, the approach has been, when I look at managed services, number one, shifting the risk. Number two is they have the better resources, and that is their core niche versus trying to build that in-house.
Yeah, very good. I just want to remind our audience, if you have any questions for our panelists, go ahead, send them in now, the Q&A box, the lower right-hand corner of your screen, and leave the default set to all panelists. Let's touch on, you know, it's another favorite issue under security. David, why don't you start on this one? Biomedical devices, is that something that provides its own unique and scary set of issues, and how are you working on that?
Oh yeah, and I think that's one of the scariest things, right? Cash registers that are connected to the internet are getting hacked, therefore getting access to the infrastructure at an organization. Thermostats get hacked, so definitely biomedical devices is a big risk. I don't know the answer to this because we don't have defined standards. You have lots of device manufacturers that want either a separate network, which may be the way to go, or they need to write off your backbone. So it is very sensitive. At this point, I don't know how to address it. I'm trying to talk to lots of other organizations to understand philosophically how are they going to address this, because as we mature, you know, the Internet of Things, everything's going to be connected. Everything's going to be smarter. So therefore, your risk just goes up exponentially. So at this point, I don't know how to address the biomedical devices, but it's heavily on my mind. And when you think about it from an experience perspective, it obviously creates lots of efficiencies, creates a better experience. But at the same, how do I not ruin that experience, but at the same time keep the organization secure? So that's a big hurdle and big question I have with biomedical devices.
Brian?
Yeah, it's a worry, but what the approach we're taking is segmentation and microzoning, and as we move potentially into a co-location facility, we're going to look at a software-defined network model where we put clinical devices, biomedical devices in their own zone, and we can control access and communications to and from those devices very granularly. We do have some of that in place today, but not as much as I would like. And then secondly, I'm not going to name the vendor, but there's a vendor out there that has a solution now that puts an appliance or a firewall between biomedical devices and the rest of the network, and actually reviews the communication protocols to and from those devices and also their destination communications, and it looks for anomalies. And so if an infusion pump is hijacked and looking to talk to an application or a system that it's not normally talking to, this technology supposedly will alert you to that. So we're investigating that as a potential supplemental control.
Very good, very good. Question for you, Brian, from the audience. What is the biggest difference between providers and payers regarding security awareness?
That's a loaded question. I'll get in trouble with one group or the other, but I think of payers or insurance companies as being a bit more business focused. They run the organization more like a financial services company, and so a large degree I find that they're easier to have engaged in training and awareness activities, a little more accustomed to that sort of requirement because they typically do have more of a business or a financial services background. Now, on the other side of the coin, providers have a lot of clinical training. They certainly understand the value of protected health information and their responsibilities to safeguard it, but they often don't have the time or necessarily the ability to fully partake in training and awareness activities. So when I'm designing a training and awareness curriculum, I actually take those two specific examples as different audiences and how you design and deploy an awareness program that's going to be most effective for them.
Very good, very good. All right. And David, I think you touched on this before. Let's talk about the human risk factor. Now, everybody knows if you didn't, those damn users, right? If you didn't have anybody using the systems, you could have them perfectly secure and never have a breach. But there's that idea of, and I'm kind of switching this question a little bit, I'd like to talk more about the idea of security versus usability, and there's always that balance, right? The more you lock them down, the less usable they are. Is that true? Is that necessarily sort of, you're just somewhere on that spectrum, and as you push to the one side, the other gets, moves over? David?
So obviously, right, if you go back to paper, yeah, that'll probably be true. There'll be no more electronic issues, but that's not the whole point, right? It's the whole point is how do you utilize technology to be a competitive advantage? How do you utilize technology to be more efficient? But at the same time, we have to keep it secure. So I trend on the side of experience versus security. So I actually like the fact that I do have a check and balance or compliance where I can talk about creating the best experience where I do not want to lock down things. You always hear about organization. One of the biggest hurdles has always been where a traditional CIO wants to lock down all the social media sites. They think if we block sites like Facebook, Instagram, things like that, it's going to keep things locked down. Well, at the same time, the staff all have a computer in their pocket now with their phones. They could still get access. Doesn't mean so. It's really about let's provide people access, but let's figure out how can we keep it secure at the same time. A lot of it's also education, right? A lot of the phishing attack it comes from internally where an employee clicks on a link where they're not supposed to. Well, a lot of that could be prevented by educating. It's not a technology solution that you could probably try to block as much as you can, but if things falls through the crack, you could work and focus on education, and that could prevent security incidents as well. So it's a tough balancing act. I face that on a regular basis, but I err on the side of I want to create the best experience. I want to provide as much access as I can to the organization, and let's educate them on areas to be aware of so that we do not have any security incidents.
Brian, what's your philosophy on security versus usability?
I really think it depends on the industry you work in. If you're the Department of Defense, you're probably erring towards more security. But again, in the healthcare industry, our #1 mission is to deliver top quality patient care. And so I'm one of the CISOs that really takes a practical approach. I try and use security as an enabler. I tell people that just because you make it more secure doesn't mean that it becomes less functional. And if you go out and provide proximity card access for physicians and clinicians, you create an atmosphere where they don't have to log in and out, in and out, in and out. All of a sudden you've created a more secure solution, but it's actually easier for them to access the applications that they need. So I err on the side of providing functionality, and I will usually say, yes, let's do it, but let's, make sure that there are some compensating or mitigating controls in place that we can protect ourselves.
Very good. Well, that is about all we had time for today. When you close out your window, you'll see a post-event survey. If you could take a moment and answer that, it would be great. I want to thank our panelists, Bryan Kissinger and David Chou. As I mentioned, you'll receive an email when our archive recording has been posted to our YouTube channel, so you can go ahead and enjoy that whenever you like. For those of you attending today's event, if you have the Chime CHCIO certification, attending our events gets you 1 CEU, so let Chime know you were here. And if you've asked us to do so, we certainly will. Sponsorship opportunities, you can contact Nancy Wilcox, and if you need a certificate of attendance for another CEU program, you can use the final slide. And of course, go to our website to view our upcoming schedule. So once again, I want to thank Bryan, David, our attendees. Everybody have a wonderful day. Thank you.
Thank you.